Did you know that it is possible to eliminate urinary incontinence even in old age? This problem, which affects millions of people and can interfere with quality of life, has a solution. And today, in Health Now, I will reveal to you a simple method shared by a veteran urologist, which can help you or a loved one regain control. If you or someone close to you struggles with urinary incontinence, this video is for you. No matter your age or how long you've been dealing with this problem, with a few simple habits, you can improve your well-being and quality of life. I encourage you to stay until the end, because I'll share a key that could change everything. I'm Dr. Garcia, and you're on Health Now, your trusted channel to learn about health and well-being in a practical and natural way. Here we share easy-to-apply tips that can truly make a difference. Today we'll talk about urinary incontinence, an issue that affects both men and women, especially in the elderly. Lack of bladder control not only affects you physically, but also emotionally and socially. However, this problem doesn't have to define your life, and with the tips you'll see today, you'll be able to take effective steps to regain your confidence. In this video, you'll learn about an approach endorsed by a urologist with decades of experience to improve bladder health and reduce or even eliminate urinary incontinence. We'll cover specific exercises, dietary changes, and daily habits that help strengthen the urinary system, all in a simple and accessible way that anyone can put into practice. If this type of content interests you, I invite you to subscribe to the channel and activate the bell so you don't miss any more health recommendations. And I suggest you stay with me until the end of the video, because the last recommendation is a real key to saying goodbye to incontinence. Urinary incontinence is much more than just an inconvenience. It is a problem that affects millions of people and can have a profound impact on quality of life. When someone experiences involuntary urine loss, they may be limited in their daily activities, feel constant discomfort, and, in many cases, avoid social situations due to embarrassment or fear of an accident. The most common symptoms include those little leaks that occur without warning and, for some, can happen when laughing, coughing, or even exercising. There is also the urge to go to the bathroom more frequently than usual, and, in some cases, difficulty controlling urine during stressful situations. But did you know that urinary incontinence is not a curse? Although many people believe it is an inevitable consequence of aging, there are strategies that can help you regain control. With simple and effective changes, it is possible to alleviate or even eliminate the symptoms, and this is exactly what we will see throughout this video. In the next chapter, I will show you how some specific exercises can strengthen the necessary muscles. Translated from Spanish to English. www.onlinedoctranslator.com to maintain bladder control. These exercises, easy to perform at any time of the day, are one of the first recommendations made by experts. One of the most effective ways to improve urinary control is through Kegel exercises. These exercises, recommended by urologists and pelvic health specialists, help strengthen the pelvic floor muscles, which are essential for urine containment. With a regular Kegel routine, many people see significant improvements in a short time. How do you do it? It's very simple. First, identify the correct muscles, those you would use to stop the flow of urine. Then, contract those muscles for 5 seconds and relax them for another 5. It's important not to involve other muscles, such as those in your abdomen or buttocks. This exercise can be repeated 10 to 15 times, and ideally, it should be done at least 3 times a day. Incorporating Kegel exercises into your daily routine is easy. You can practice them while brushing your teeth, watching TV, or even during phone calls. This way, the exercises become a habit, and their benefits start to become evident over time. However, exercise alone is not always enough. Diet also plays a crucial role in bladder health. In the next chapter, we will explore how certain foods can strengthen the bladder and, in some cases, prevent irritation that can lead to incontinence. Diet plays a crucial role in the health of our bladder. Eating certain foods can help keep our bladder strong and reduce incontinence symptoms, while others can cause irritation, increasing the frequency and urgency of going to the bathroom. By making wise food choices, we can give our urinary system the support it needs. To strengthen the bladder, it is advisable to eat fruits and vegetables rich in water, such as watermelon and cucumber, which help maintain good hydration without overloading the system. Also, foods rich in magnesium, such as spinach and almonds, are beneficial, since magnesium helps relax the muscles, reducing bladder spasms. On the other hand, there are foods and drinks that are best avoided if we want to prevent bladder irritation. Coffee, alcohol, and spicy foods are known to be irritants. These substances can make the bladder more sensitive, increasing the risk of incontinence. A good practice is to keep a food diary to identify possible triggers that worsen incontinence symptoms. This way, you can adjust your diet in a personalized way, avoiding those foods that do not favor your urinary health. Now that you know how proper nutrition can make a difference, the next step is to understand the importance of hydration. In the next chapter, we will look at how maintaining proper fluid balance can be essential to preventing incontinence. Hydration is essential for good urinary health. It may seem counterintuitive, but drinking enough water is essential to preventing incontinence. When we don't consume the right amount of fluids, urine becomes concentrated, which can irritate the bladder and increase the urge to go to the bathroom. To keep your bladder in balance, it's best to drink water in small amounts throughout the day, rather than large amounts at once. This allows your bladder to process the fluid without becoming overloaded, reducing the likelihood of experiencing episodes of incontinence. It's advisable to avoid excessive fluid consumption before bedtime, so as not to have sleep interruptions due to the need to go to the bathroom. However, it is important not to limit fluid intake too much, as this can also be counterproductive. The key is to find the right balance. A properly hydrated bladder is less prone to irritation and can function more steadily. Now that you know how proper hydration can make a difference, in the next chapter, we'll explore some daily habits that can help you prevent incontinence. With small changes in your routine, it's possible to improve bladder health and reduce the risk of uncomfortable episodes. In addition to diet and hydration, small changes in daily habits can make a big difference for those who want to prevent incontinence. These adjustments help strengthen bladder control and reduce the likelihood of leaks. A good habit is to go to the bathroom at regular intervals, rather than waiting until you feel an extreme urge. Emptying your bladder frequently prevents it from becoming too full, reducing the risk of incontinence. Setting a schedule can help you maintain this habit and train your bladder to function in a more controlled manner. Another tip is to avoid lifting heavy objects, as the strain can weaken the pelvic floor muscles, increasing the likelihood of incontinence. If you need to lift weight, try to distribute the load and avoid sudden movements that overload these muscles, essential for urinary containment. Finally, including low-impact physical activities, such as walking, is beneficial. This type of exercise improves circulation, tones muscles, and reduces the risk of weakening the pelvic floor. Staying active is key to overall health and helps the body be better prepared to control the bladder. Although these habits may be effective for many people, in some cases, incontinence persists. If symptoms continue, it may be a sign that further intervention is needed. In the next chapter, we'll discuss when it's important to consult a specialist. While changes in diet, hydration, and daily habits can make a big difference, there are cases where these adjustments are not enough. Urinary incontinence is a common problem, but if symptoms persist or worsen over time, it is important to know when to seek professional help. Some signs indicate that it's time to see a specialist. If, for example, you experience pain when urinating, notice blood in your urine, or episodes of incontinence severely interfere with your quality of life, it's advisable to see a urologist. These symptoms could be indicative of underlying conditions that require medical attention. Additionally, when incontinence significantly affects emotional well-being and limits daily activities, a specialist can offer additional guidance. There are specific treatments that can help control or reduce symptoms, such as pelvic physical therapy, medications, and even minimally invasive procedures in more severe cases. There is no need to suffer in silence. A urologist can help you explore personalized options and offer a treatment plan tailored to your needs. Acting early can prevent the problem from worsening and significantly improve your quality of life. In the next chapter, we will discuss natural and alternative treatments that can also support urinary health and offer relief in some cases. These approaches can be a complementary option for those seeking natural solutions. In addition to conventional treatments, there are natural and alternative options that can offer relief to those dealing with incontinence. These approaches are ideal for those looking for more natural solutions or wishing to supplement their current treatment. A popular choice is herbal teas. Plants such as horsetail and chamomile have been used for centuries to support urinary system health. Horsetail, for example, is known for its mild diuretic properties, which help reduce fluid retention and inflammation. Chamomile, on the other hand, has calming effects that can relieve bladder irritation. Another alternative is acupuncture, a traditional Chinese medicine practice that has shown promise in some studies for improving urinary control. By stimulating certain points on the body, acupuncture can help strengthen pelvic floor muscles and reduce episodes of incontinence. It's important to remember that these natural treatments may not be effective for everyone, and results vary from person to person. The best way to take advantage of these options is to experiment safely and consult with a healthcare professional to ensure they don't interfere with other treatments. With this combination of natural options, you may find an approach that complements your efforts to improve your bladder health. In the next chapter, we will summarize the main recommendations and remember how small changes can make a big difference in daily life. Urinary incontinence doesn't have to be an inevitable part of aging or an obstacle in daily life. With the right approach and some simple changes, it's possible to regain control and significantly improve your quality of life. Today, we've explored several practical tips and approaches that can help you deal with this problem effectively. First, we saw that incontinence affects millions of people, and that, although common, it is not something we should just accept. With Kegel exercises, which strengthen the pelvic floor muscles, we take the first step towards greater control. These exercises are easy to incorporate into your daily routine and, over time, can make a big difference. In terms of diet, we talked about how certain foods help maintain a strong bladder, and others can be irritating. Choosing water-rich fruits, such as watermelon, and magnesium-rich foods, such as spinach, can help reduce symptoms. Additionally, avoiding coffee, alcohol, and spicy foods contributes to more stable urinary health. Hydration is also key. Drinking water at regular intervals and avoiding large amounts of fluids before bed can help control urinary frequency and reduce bladder irritation. And let's not forget daily habits, such as going to the bathroom at regular times and avoiding heavy lifting, which can keep pelvic muscles in good shape. For those who continue to deal with incontinence despite these changes, seeking the help of a specialist is essential. Not all cases can be solved by habits alone, and a urologist can offer personalized and effective options. Additionally, natural and alternative options such as herbal teas and acupuncture can complement treatment and provide additional support. Don't ignore symptoms. Acting early can prevent future complications and improve your well-being. Adopting these changes today can make a difference in the long run. If you found this video useful, subscribe to the channel and turn on the bell to receive more health tips. Finally, I invite you to share this video with friends and family who can also benefit from these recommendations. Do you know someone who might find this information useful? Leave it in the comments and share your experience.